And thanks so much for joining us. We do have in the studio David Deaton, CEO of Ozark Health Medical Center and Ozark Health Nursing and Rehab, and Danny Weaver. He's administrator of Ozark Health Nursing and Rehab. And I tell you, we really appreciate you guys dropping by, because one thing that we wanted to highlight, David, as we talked before, and Danny, thanks for coming by, but that's nursing homes. You know, they have been shut down since I think like March 8th or 9th. No visitors, no doctors. That's a unprecedented move.
In my career, I've never seen anything like it, and I can't think that it's ever been done before.
Yeah.
And not only Arkansas, but around the country that I've heard. So
it's a big deal. But, you know, that's something, Danny, when you look at this, it is a very important thing to protect those that's vulnerable, which is the 65 plus. And the nursing homes are a big target for this virus.
Yeah, our biggest goal is to keep as much from coming into the facility as we can. Of course, we have the staff that has to come in and out the doors, but the keeping stuff from coming in and people from coming in protects the residents, and that's our goal. That's what we're here for.
But there's three things that we've talked about that really you've talked about even before going on that made this possible. Really, I mean, this is something that not having that up in this area in the nursing homes is a credit. Got to give some due to the staffs, because they have had to work overtime on this.
that's right. You know, there's been some cases in nursing homes in Arkansas. To be honest, if it's this prevalent in the community, around the country, around the world, in fact, it's virtually impossible to guarantee you can have it inside a nursing home. In Arkansas, we've had a number of cases, but our nursing home has been very fortunate, I guess you could say. Three reasons, I think, for it. One is the state came in real early, like you mentioned, basically said no visitors, no outside visitors, which was very difficult for us to do. I mean, it was very hard for the well-being of the residents and also the staff. And the second is our staff does a tremendous job with infection control. They've always done a great job, but they've stepped it up, as you can imagine. And third, just God's been good to us and kept us safe from it. So fortunately, are able to say that we've had zero cases in Ozark Health Nursing and Rehab.
When you look at, Danny, the well-being of the patients, this is something that social interaction is vital for a nursing home.
It is. And, you know, we've always encouraged families to come, and we have care plan meetings to get the families in. The more family involvement is what we've always done. So this is like flip that upside down, and now we're telling families to stay away. We're doing as much as we can. The staff has been amazing. We're FaceTiming with families and trying to get that family interaction without it being physical. And that's helped. That's helped a lot.
Well, and that's what's going on with all nursing homes. They've all got the same dilemma. So, I mean, you've got colleagues in this business. You're probably saying, this is unprecedented, you know, when you're talking to them, you know, and you've become the family. You've become the child. You've become the grandchild. You've become the spouse. I mean, you have to touch that patient more than ever. The one thing is kind of a crazy question. Has it stopped a lot of the other, like the flu and some of that as well, do you think?
Since we've locked down, we haven't had any new cases of flu. We had some flu beforehand, but since we've locked down, no, it's stopped that.
You know, so that's something. This may be some ways we can kind of like, hey, this can set some different precedents for nursing homes.
If we don't forget the lessons we learned,
That's true.
society at large will be much better off going forward when it comes to routine things such as flu. My hope is that people a year from now will remember to wash your hands, the do's and the don'ts that we're learning today. Hopefully we won't have to walk around wearing masks, but would guess that you'll see a lot of mask wearing in the years ahead during flu season and things like that. So that's not always bad. So I think we'll learn a few lessons that we'll carry forward.
Now, another thing that we find out that, you know, my wife has to see me a whole lot more than normal. And so because, you know, this social distancing, we're not going out. We're together pretty much 90% of the time. So she's probably found some things that she's like, Bob, why don't you become a truck driver?
That's right. Yeah, we were talking about truck driver marriages. Some of them last a long time. And yeah, people are, I guess you could say, in Arkansas, we call it getting on other people's nerves. But togetherness has become there's a whole new meaning to it. And I'll tell you, I think there's a positive to that. We've learned that we can actually stay home and be with each other now, and we might not have thought so before. And so I think a lot of good things have come out of it. A lot of things we used to think were very important are maybe not so important now. So I think there's good things about it, but there's also been some challenges, I would guess.
That's right. Well, keeping our prayers for the nursing homes, because that is something this COVID-19 is a bad virus for them. And I got to say, thumbs up to all the nursing homes in Arkansas. They've done an awesome job.
They have done.
Really.
Been
So And to the staff. You know, we always talk about the healthcare providers. Well, nursing home staff is a healthcare provider, but I'd say they are on the front line more so than even the hospitals, because they have got to keep that virus out of the most vulnerable in our community.
That's
Yes,
right.
absolutely.
I appreciate you guys dropping by.
Thank you.
Bob.
And we've been talking with CEO of Ozark Health Medical Center and Ozark Health Nursing and Rehab, David Deaton, and Danny Weaver, administrator of Ozark Health Nursing and Rehab. Thanks for joining us, guys.
Thank you.
Thank you, Bob.